Hi, I'm Dr. Tim O'Carrigan, orthopaedic surgeon, and I specialise in foot and ankle surgery and limb reconstruction. And today I'm going to talk about Achilles tendon rupture. Achilles ruptures are a common injury that can occur during sporting or other activities. It typically affects middle-aged people, and the activities that they're undertaking when that occurs often involve a rapid acceleration or deceleration, so jumping or landing or suddenly pushing against a heavy object very rapidly. People typically described feeling like something's gone off in their calf or they're being kicked. If they're playing soccer or some other sporting activity, they think that somebody else has kicked them in the calf. This is a very, very common description of the injury. The Achilles tendon is the tendon that connects the heel bone, the calcaneus, to the calf muscle. The calf muscle itself is made up of two muscles, the gastrocnemius, which is the bulky muscle up at the back of your calf, and there's another muscle called the soleus, which joins the gastroc tendon further down, and then just above the ankle it's just pure tendon, which is a combination of those two muscles. Where people rupture their Achilles typically is in this area here, which is 4 to 5 centimeters above the insertion to the calc, and it's described as a watershed area where the blood supply coming up from the calc and the blood supply coming down from where the muscle is, there's a relative area in between which has lower blood supply. The other area that Achilles can rupture is actually off the heel bone itself, but that's much less common than the rupture in this area. Achilles ruptures can be treated operatively or non-operatively. In the non-operative situation, they're placed in a moon boot, usually with wedges so that the foot's pointing down slightly. And that can get good outcomes if the treatment is instituted early and a strict protocol is adhered to. The risk with non-operative management is that it can heal stretched out, and if the tendon is too long, it can lead to calf weakness and an inability to get that muscle strength and inability to return to your previous activities at the same level. The advantage, obviously, of non-operative management is you avoid surgery and you avoid the potential risks associated with surgery. My preferred treatment for patients, if appropriate, is operative management. Now, that is percutaneous repair of the Achilles. The problem with operative management in the past has been wound healing and the potential for wound problems to occur, which is a very serious problem because the Achilles tendon is just underneath the skin. So wound problems can easily lead to deep infection, and that's a very serious problem if it occurs. The percutaneous repair techniques involves a small transverse incision at the level of the rupture, and we open the tendon sheath up. We're not disturbing the blood supply. We pass a specially designed jig within the tendon sheath, and then we can get suture fixation percutaneously both for the tendon above and below the rupture, and we deliver those tendons within the tendon sheath. So it's an all-inside repair, and we can restore the length, we can restore some of the initial integrity, and we don't disturb the natural healing process that occurs with the rupture. And so it has the advantage of surgery in terms of directly restoring the length, but it avoids some of the problems of open repair with wound healing. And in my hands, I found it to be a very effective way to provide a good solution for patients for a common injury. After surgery, the patients are discharged home once cleared by the physiotherapist. They're in a plaster back slab and the foot is pointing down. The patient is reviewed at 1 week to check the wounds and changed into a boot, usually with those heel wedges. and you can go on crutches and be partial weight bearing. And we gradually change those wedges to bring the foot towards neutral over that first 6 weeks. After 6 weeks, the crutches are discarded, physiotherapy becomes more involved. We work on a graduated strengthening program, and the patient's out of any sort of boot by 10 to 12 weeks post-surgery. So with repair of the Achilles, we're trying to restore the length and the integrity to the tendon. That gives us the best chance to restore the original muscle-tendon ratio, muscle strength, and getting the patient back to their previous level of function with the minimal risk of complications.